Dr. Capone here, Mahoning Valley Wellness. Today we're going to talk about some of the stuff that's going around this time of the year, like the common cold, strep throat, and the flu, how to differentiate it, and how to help yourself a little bit. So the common cold has cough, sneezing, runny nose. Typically we'll have a sore throat. Sometimes we'll have fever associated with it, versus strep throat, where you get all the sore throat and the swollen glands, but you don't necessarily have the upper respiratory symptoms of like the congestion, the runny nose, the cough, versus the flu, well, you'll have all of those symptoms, plus typically really fatigued and have a higher fever and also some body aches. So those are your top three that are going around right now. And what can you do to help yourself? Well, the first thing is with the common cold, it will go away on its own without any medication, but the symptoms are bothersome. So you can take over-the-counter medications. If you have a child under the age of 6, you want to talk to your doctor first to make sure it's safe to take those over-the-counter meds. If they're over the age of 6, just be cautious with the medications to make sure that you're not taking two different medications with acetaminophen in them, because you don't want to have trouble with the liver. You also want to make sure that you're not giving your child, anybody under the age of 18, aspirin when they have a virus, because that can lead to a serious syndrome called Reye's syndrome that can affect the liver as well. So overall, you want to check the ingredients, check the dosing instructions, and follow that. What can you do to prevent getting the common cold? So there are a few things that you can do. The biggest one is washing your hands. Washing your hands for 20 seconds with soap makes a significant difference in your risk of getting sick. The second thing is cleaning surfaces around you. So when viruses sit, they drop on your table, on the handrails, on the door handles. They can last for up to 2 hours. And then you pick it up and then you infect yourself. So by cleaning the surfaces in your house, like the door handles, the chair rails, the stairwell, the table, with Clorox, you are reducing your risk significantly for getting sick. The other thing too is staying away from sick people. If you know somebody's sick, don't go near them. If you're sick, stay home. You don't need to expose everybody to your illness. So those are your big things on how to prevent it. How do you feel better? Well, what you can do for yourself is get lots of rest. When you're sick with a cold, get plenty of sleep. Take your naps, drink plenty of fluids. Fluids are huge. You lose a lot of fluid through the drainage that happens through your nose, down into the back of your chest, that phlegm. Your sinuses fill up with fluid, so you are losing a ton of fluid. So drinking is your number one way to make you feel better. So vitamin C juices are wonderful because they help. Water is great. Gatorade is wonderful. Chicken broth is great. Any of those things, so broth, sports drinks, water, or juices are all fine. Whatever you want, just drink, and drink. You can use a cool mist humidifier to moisturize the air. That helps a little bit. You can also use a nasal spray up your nose. That will help you a little bit. And avoiding smoking or being near people who are smoking. Those are all big things that you can do to help yourself feel better. Sometimes a common cold can lead to more serious problems like ear infections, bronchitis, pneumonia, sinusitis, which all require an antibiotic. So you definitely want to call your doc if you're having those sorts of symptoms. If you have a fever prolonged for days, you want to call your doc. If your sore throat prevents you from drinking and eating, you definitely want to call your doc. If your cough lasts more than 10 days, you want to give your doctor a call. And if you're having chest pain when you cough, it's a good idea to check in with your doc to make sure that you may not have a pneumonia. Also, coughing up blood is never normal. You definitely want to call your doc with that too. If your child is acting very confused when they have a fever, you definitely want to make a phone call to your doc or go to the ER, depending. If you're having trouble breathing, you definitely want to head to the ER. Hope that helps everybody. This is Dr. Capone, Mahoning Valley Wellness. Stay healthy, everyone.